All right, chapter 30, sexual health. That's our last chapter that we needed to read for module 2. So again, I don't own this material. Under fair use, I am providing lecture content for only my nursing students using this material. All content within is only for educational purposes for nursing students and does not provide medical advice. All right, so for sexual reproductive anatomy and physiology, you need to go back. Remember in A and P, you learned all the parts and pieces of all the organs. You learned about the menstrual cycle, and you also learned about the parts and organs for the male. That's just a review for that. You want to make sure that you know all of the parts and pieces. You may have a patient come into the ER, come into the clinic, come in wherever you are a nurse, and you need to have a general working knowledge of these things. Now, especially if you're going into OB, okay? Because we talk a lot about sexual and reproductive anatomy and physiology in OB as well. So you need to have a good working knowledge of these parts. So, sex, a concept related to sexuality, that's biological sex being male or female. And then gender roles comes from the sex. Gender roles are societal norms for behavior, and we know that there are old stereotypes like males being physicians, males being policemen, females being nurses and teachers. Okay, so there are some old stereotypes out there still. And then gender by identity. So now there's even more concepts related to sexuality. It is not just black and white, male, female. There's a whole bunch of different combinations as well. So gender identity, know the difference between cisgender, gender binary, gender non-binary, transgender, intersex, and in transition. So you need to have a working knowledge of that. Sexual orientation is based on the gender of the person to which one is sexually attracted. So just some little knowledge pieces there that you need to remember when you're in the test. These kind of things might come up. So in completing an admission history, the nurse learns that the patient, a woman, has a sexual partner who is a woman. This data speaks to the client's sexual bias, gender role, gender identity, or sexual orientation. So a woman having a woman's sexual partner would be sexual orientation. Okay. Sexual orientation describes the gender to which a person is sexually attracted. Okay. So factors that could affect sexuality would be culture, religion, lifestyle, sexual knowledge, and life and illness, health and illness. So in sexual health, it's a state of physical, emotional, mental, and social well-being related to sexuality. That's the World Health Organization's definition. Requires positive and respectful approach to sexual relationships and optimum expression of sexuality. So they are not going to tell you if they don't feel open. So you need to be non-judgmental in your approach. All right, so Mr. Cothers and Mrs. Duncan are single older adults who live in separate rooms in an assisted living facility. The nurse aides report to the nurse that she has just seen the couple kissing and holding hands. The nurse aide then begins to laugh. Of the following options, what's the best nursing action and why? What other factors should the nurse consider? And discuss each option using the safe, effective nursing care framework. So, instruct the nurse aide that older adults still experience sexual pleasure. Call the families, inform them of their couple's actions. Remind the couple that their actions are not appropriate. or explain to the nurse's aide that sexual activity is highly unlikely between residents due to their age. What do you think you should do? I'm definitely not going to call their families. They're over 18, right? Oh my gosh. And I'm not going to tell them they're being inappropriate. And it's not highly unlikely due to their age. Okay? So I'm going to tell the nurse aide that these things still happen and they still have a right to pick and choose whomever they so desire to kiss. All right, so the sexual response cycle, just know the response cycle and how that works. Desire, excitement, plateau, orgasm, and resolution. How people express sexuality might be very different. So, intimate relationships, fantasies, erotic dreams, masturbation, shared touching. So, all of these things you could hear about. Intercourse, oral genital stimulation, anal stimulation, intercourse, and celibacy. During a well checkup visit, a 14-year-old asks you if it's okay to masturbate. Which statement by the nurse best demonstrates self knowledge? So, what do you think you should say, 14-year-old? Okay, so D. D is the best choice because it recognizes the teenager's need for more information. This is the age where many teenagers begin to have sexual desires because of hormonal changes. So D, this is one way to express sexuality. Let's explore your sexual knowledge and sexuality. Okay. All right. A 16-year-old male is brought to a clinic by his parents for treatment of a respiratory infection. When his parents leave the room, he confides in you and he thinks he may have AIDS because he has had unprotected sex with another male for 3 years. He begins to cry and says, "Please don't tell my parents. I should not be like I am." What questions would you ask your client? So just think about some of the things that you would ask this patient about this. I would probably start with your parents don't know. Why do you think? Do you want to be tested? Okay. So lots of questions you can come up with. If the results are positive, what do you want me to do? Okay. And then how do you respond to his request? Technically, because it's a sexual disease that they are asking about, they have rights. I do not have to tell his parents, but he should. So, some sexual problems that you might hear about in clinical or in the offices in the hospital, especially, is STIs, so sexually transmitted infections, dysmenorrhea, dysmenorrhea. So, whenever you see the word that means dysfunctional. So, dysfunctional bleeding, premenstrual syndrome, PMS. A lot of the times people will tell you about PMS as being swollen breasts, painful breasts, or back pain, menstrual cramps. So, a lot of questions around that with teenagers. And then negative intimate relationships that they have had. Sexual harassment, sexual assault, rape, dysfunctional intimate relationship patterns, sexual response cycle disorders like low libido, arousal disorders or orgasmic disorders. So, especially in the case of rape, you want to be really careful. That's a typical NCLEX question. And you have to remember that in the fact of rape, you need to tell them not to wash and to come in right away. So they would probably be a first line callback. Most people, when they have been raped, are thinking that people are going to be judgmental. So they'll go take a shower. But unfortunately, that's what we need for the crime kit. So you definitely want to tell someone who's been raped to not shower and come in right away. We need the clothes she was wearing. We need everything for the identification kit. Obtaining a sexual history, you want to examine your own beliefs and values first. Convey a non-judgmental attitude and non-biased approach. Be aware of your nonverbal communication, using a relaxed approach, maintaining eye contact. Provide privacy, and watch for cues of client discomfort or concerns. This is a very private matter for a lot of people. So, this patient, a 17-year-old client, comes to the clinic. She states to the nurse, I think I have an infection in my vagina. After obtaining information on the signs and symptoms, what is the best response? Can you tell me what kind of infection you think you have? Have you told your mother about your concerns? Let's discuss your current sexual activity. Or do you know how you got this infection? So if somebody tells me that they think they have an infection in their vagina, I'm assuming that they're talking about an STI, but I would want to double check, right? Are you sexually active? Would be my first question. So response C opens the dialogue about sexual activity and the potential cause for the infection in a non-threatening, respectful manner. So some nursing diagnoses that come under this chapter are ineffective sexuality patterns, sexual dysfunction, and some common teaching topics related to sexual health includes body functions, reproduction, douching, menstruation, premenstrual syndrome, and menopause. We teach a lot about breast and testicular self-exam. You definitely need to know about breast and testicular self-exam. They love to put that on the NCLEX, specifically testicular, because we don't really spend a lot of time talking about it. Prevention of STIs, contraception, counseling for sexual problems, and inappropriate sexual behavior. So you may or may not see that in clinical as well. So just being aware. The contraception and STIs will come back to haunt you in OB. It's always on the OB tests. And then teaching children about sexual predators, stranger danger, you know the deal. We do a lot of teaching around stranger danger, setting the stage for an open discussion, knowing what's going on and that it's okay to say no, no matter who it is, if it's a family member or a new friend that you met. Um, that's kind of the stranger danger talk. We talk a lot about that as well. All right, that's it for this chapter.